Welcome to SVG-TV News for Wednesday, December 2nd, 2020. I am Rochelle Batiste with the details. Prime Minister Dr. Ralph Gonsalves said that he is disappointed at the very slow pace in the delivery of road projects funded by a loan from the government of Kuwait. The loan, amounting to 32 million EC dollars, was for the development of feeder roads and secondary roads. PM Gonsalves said he has considered discontinuing the loan which the government took to execute these road projects.
I mean, the thing is moving so slow, it is frustrating. In fact, I'm wondering whether we shouldn't just, and I have to make a decision on this, whether we shouldn't just cancel that loan and have another source to finance it. If they, I mean, it's just too painstaking. I mean, it frustrates me to no end.
The Prime Minister said he has raised the issue with authorities in Kuwait, and for the time being he will continue with the project. Persons who have been receiving financial assistance from government under the COVID-19 relief support will have to wait until after the budget 2021 to know whether they will continue to receive that assistance. So said Prime Minister Dr. Ralph Gonsalves during his weekly radio program on NBC Radio Today. Some of the categories of persons receiving assistance are vendors, hospitality sector workers, and those who are unemployed due to the COVID-19 pandemic. They will continue to receive the financial assistance up to the end of this month. PM Gonsalves said that serious consideration has to be given whether to have some persons receive assistance and who will get that help.
The question is this: can we afford to carry forward the $300 for everybody whom we have been given monthly? And the corollary, can we afford not to find the money to help them?
600 persons will be added to the public assistance list come next year. These persons will also receiving $200 monthly under the COVID-19 Relief Assistance Program. The Prime Minister noted that some categories of workers can return to their employment while others still cannot do so.
And oil rig workers, well, some of the oil rig workers are going back. I've seen a few of them have indicated that they're going back. There's a problem with the cruise ships. I know a number of the cruise ship, the sailors have gotten jobs, but some of the sailors don't have easily transferable skills.
The Prime Minister said that severance payment is also an issue being addressed, as some companies do not have money to make this payment.
How I frame the issue. So there is real pain and suffering and some very difficult choices. Do we work out something where the worker, they take whatever monies they can get in 3 or 4 installments? To what extent can the government come in to assist, and the government be owed by the company?
The Ministry of Health, Wellness and the Environment today hosted an international conference for diabetes prevention control under the theme, "What have we done? What have we learned?" The Republic of China and Taiwan is partnering with the government in the fight against diabetes here in SVG. Speaking at the conference, Minister of Health Sinclair Jimmy Prince thanked the government of Taiwan for its support over the years in the fight to tackle this non-communicable disease in SVG. Minister Prince said diabetes is a major health problem that must be dealt with as a society.
Into Memorial Hospital, that's last year, diabetes comes in a close second, with just over 600 cases, a total of 8% of admissions at that particular hospital. I note also that last year there were 83 amputations performed at the MCMH. Of this number, 80.7% was secondary to diabetes complications. Amputations of the toe, 49.3%, were most common, and followed by below-the-knee amputations of 23.9%. So we have a major health problem that we have to deal with as a society.
The health minister said he is convinced that not enough persons are aware of the dangers of diabetes.
If we had another situation where so many people suffer, as much as they suffer now from this diabetes, I think we will be up in arms about it. But it seems that as silent as it is, we are mirroring that in our own responses to diabetes in St. Vincent and the Grenadines, and indeed in the rest of the Caribbean. I do not think that we are unaware as much as our way of life has lulled us into a state of helpless complacency. That's why this conference is so important. That's why it is important that you take part in it.
Minister Prince, however, noted that a lot has been done locally, regionally, and internationally in combating this non-communicable disease.
Over the decade, St. Vincent and the Grenadines have been very proactive in addressing non-communicable diseases. This has been reflected in the development of national policies and strategic plans addressing NCDs, including the National Economic and Social Development Plan, National Health Sector Strategic Plan, wellness policies, and the National Action Plan for the Prevention and Control of NCDs. That's from 2017 to 2025. And you must have heard from time to time the government in Parliament, or the Parliament itself, dealing with issues related to these. The National NCDs Action Plan proposes a renewal of primary health care with a focus on prevention and promotion, implementation of public awareness campaigns addressing NCDs and their risk factors, implementing comprehensive tobacco control, etc.
And the government of the Republic of China and Taiwan and the Ministry of Health, Wellness and the Environment have been working together to combat diabetes in St. Vincent and the Grenadines. This is being done on the capacity building project, which began in February 1st, 2018. Speaking at today's International Conference for Diabetes Prevention and Control, the ambassador of Taiwan to SVG, Calvin Ho, said the project aims to reduce the burden of diabetes expenditure in SVG.
In this country through building healthcare personnel capacity in pre-diabetes diagnosis, diabetes treatment, and identifying high-risk groups, establishing a case management system, and promoting health education. So the major components of the project including, first, assist in planning effective integrated care strategies and practices on the prevention and control of diabetes. Second, strengthen the ability of integrated diabetes care in healthcare facilities. Third, improve self-management in health of community people for prevention and control of diabetes.
Ambassador Ho said that persons from the Ministry of Health received training in Taiwan to be further educated about diabetes.
Had visited Taiwan to see how diabetes prevention and control was implemented under different settings. An integrated diabetes care report with recommendations for St. Vincent Ministry of Health was created by the delegates after the visiting trip in Taiwan. 19 healthcare personnel, including doctors, nurses, family nurse practitioners, and nutritionists, were trained in Taiwan by the Mackay Memorial Hospital, which the hospital's diabetes team was awarded the Diabetes Care Network Quality Award from 2014 and 2016 by the Health Promotion Administration, Ministry of Health and Welfare in Taiwan.
Ambassador Ho said following their stint in Taiwan, the persons were engaged in a workshop here in SVG to pass on the knowledge they had gained. The assistance also included the provision by Taiwan of machines and equipment to the government to help improve the data on diabetes and foot care.
Now, act as the seed instructors for the project and begin to organize workshops to share what they have learned and seen from Mackay Memorial Hospital and other health organizations in Taiwan. For those health and personnel who attended the workshops, they were expected to practice what they have learned from the workshop and arrange outreach, screening and health education activities to the publics. And equipment for food care, retina camera and its operation system, hemoglobin ELK machine and test kits, mobile unit truck, and diabetes health education models were provided.
SVG is among 16 Caribbean countries that stand to benefit from a climate change and health project spearheaded by the Pan American Health Organization, PAHO, and other partners. The Strengthening Climate Resilient Health Systems Project, which was launched on Monday, December 1st, 2020, seeks to reduce death and disease from the expected health consequences of climate change in the participating countries, with the aim of bolstering health systems to withstand climate threats. Director of PAHO, Dr. Carissa Etienne, said the project seeks to contribute to the response to the threats of climate change to lives and livelihoods in small island states.
It's unique in that it brings together the work of 5 Caribbean organizations, as well as PAHO, other UN agencies, and others, through a partnership that is aimed at improving health conditions across 16 countries. The project is responsive to the CARICOM Caribbean Cooperation in Health Strategy, aimed at reducing mortality and morbidity from health consequences of climate change and promoting linkages to the environmental determinants of health. Consistent with developmental approaches in the Caribbean, it emphasizes multi-sectoral and interdisciplinary action to address climatic impacts on health and supports a cadre of new climate and health leaders.
Dr. Etienne said the project also promotes evidence for the frequently hidden health co-benefits of climate action and supports the implementation of health-related plans and resources for health mitigation and adaptation.
This project represents the first regional interdisciplinary effort of its kind that will synergize Caribbean technical support, advance the public's understanding of the impacts from climate change on health, and build the case for strengthening the health response. The EU CARIFORUM project will also support countries to access climate funding. The World Health Organization, and therefore PAHO, is now a delivery partner to the Green Climate Fund. And PAHO has been working with Caribbean countries on a proposal for the GCF to access additional fundings and therefore complement the activities covered by the EU CARIFORUM project. Similar project proposals are currently being prepared for other subregions and countries of the Americas.
The PAHO director further noted that COVID-19 has provided society with a much deeper understanding of the linkages that bind the global community and has re-emphasized some fundamental lessons which the project seeks to embrace.
Lesson number 1, together we are strong. We cannot do this alone. We are at a crucial point in time in the Americas when we must increase our solidarity and intergovernmental collaboration to address these issues that are arguably the health challenges of the century. The Americas must embrace mechanisms for countries to come together around climate change. I'm especially pleased with the partners who are here this afternoon. And I do believe that the strength of having CARICOM, SICA, and ACTO working together provides a strong platform for cooperation between integration mechanisms. The second lesson, invest in health systems. Robust and well-resourced healthcare systems are vital to protect us from the impacts of pandemics, and they are also necessary to address the health impacts of climate change. It is now more evident than ever that access to healthcare, equity, and protection of the environment are the underpinnings of a robust global economy.
CARICOM Secretary General Ambassador Erwin LaRocque said he fully endorsed the project, which is critical at this time, noting that the overall health effects of a changing climate are overwhelmingly negative.
This project brings with it a great deal of expectation for a number of reasons, chief among them being the need for Caribbean-specific data and information to drive policy interventions and actions. Perhaps even more urgently, it is the expectation that this intervention will address the need to shore up the resilience of this region to the impacts of economic, health, environmental, and social crises like the COVID-19 pandemic we are currently battling. Climate change and the COVID-19 pandemic as single occurrences are devastating for vulnerable countries such as small island and low-lying coastal developing states, SIDS, like CARIFORUM member states. When combined, the consequences and toll on the lives and livelihood of our peoples are enormous. To combat these challenges, our region has come together using the institutions that we have established and which will be involved in the implementation of this project.
Over the next 5 years, the 16 participating countries are expected to be able to bolster their communities and health systems to withstand the impacts of climate change, thanks to the collaboration of the network of sub-regional implementing partners. Apart from this country, the other beneficiary countries of the EU-funded project are Antigua and Barbuda, the Bahamas, Barbados, Belize, Cuba, Dominica, the Dominican Republic, Grenada, Guyana, Haiti, Jamaica, St. Kitts and Nevis, St. Lucia, Suriname, and Trinidad and Tobago. In other news, in an effort to ensure there are sufficient nurses in the local health system, the government has decided to continue to pay nurses the 1,000 EC monthly support. Director of the Community College, Nigel Scott, confirmed that 78 nurses have been accepted for training in the 2021 Nursing Associate Degree Program. And Prime Minister Dr. Ralph Gonsalves said he will be taking the names to Cabinet for approval for them to be paid.
Well, broadly, and then they gave the list of 78. But we had to at Cabinet accept this in order so that the funding would be made available. Because remember, each of them is going to be paid.
Coordinator of the HIV/AIDS Secretariat, Winfield Tanis Abbott, has issued an appeal to the public to end stigma and discrimination against persons living with HIV and AIDS. Tanis Abbott told SVGTV News that this approach to persons living with HIV/AIDS can lead to them becoming depressed and commit suicide.
That is the silent killer, because you find it that when persons are being stigmatized or discriminated, they become depressed, and their attitude changes. They get into their inner self, and sometimes they contemplate committing suicide. And we're asking the general public to look out for each other, because we have to be our brothers and sisters keeper. And let us all come together to eliminate and end AIDS by 2030.
He also sent a warning to persons living with HIV/AIDS about the dangers of contracting COVID-19.
Persons living with HIV and AIDS, in this COVID-19 pandemic, we are asking you to be very careful, very, very careful, because someone living with HIV and COVID-19, not very good friends at all. So you will take every precautionary measures to stay COVID-19.
Tanis Abbott has also issued an appeal to persons living with HIV/AIDS and have not visited the infectious disease clinic for months not to be afraid to attend, and they may also call the workers there.
There are some persons living with HIV who have not been going to the clinic for months. And I am making a very strong appeal to you. Please, please, do not be afraid. Give us a telephone call at 451-2489. That is the number for the National AIDS Secretariat or the Infectious Disease Clinic, or what we'll call the ID Clinic, at 456-2948. I'm encouraging all Vincentians to get tested. Know your status. Know if you are negative, to continue the way that you are, what you are doing by keeping safe, and if you are positive, so that you can go straight into treatment and care.
Tanis Abbott, who was speaking at yesterday's World AIDS Day activities at Paul's Avenue, said that persons who do not continue using their medication will be at greater risk.
And those persons living with HIV, we are asking you, please go to the clinic, had yet taken your medication, because once you start taking medication and you stop, you will find yourself not having a viral, you'll find yourself not being virally suppressed. So we are asking persons to always make sure they visit the infectious disease clinic, get themselves checked out, and then the doctor will deal with you from there, what treatment you go on, and what is expected of you to do.
There is a scarcity of chicken wings in St. Vincent and the Grenadines due to the ban on poultry imports from the United Kingdom. The Ministry of Agriculture recently announced a ban on the importation of poultry and poultry products from the UK as a result of the avian influenza or bird flu. Chief Executive Officer of Couriers Distribution, one of the main importers of poultry into SVG, Jimmy Ford, told SVGTV News that over 95% of their chicken wings are imported from the United Kingdom because the prices are better, while the other chicken parts are sourced from the US. Ford said because the ban on poultry chicken wings was not expected in SVG, there will be a general shortage of chicken parts throughout the country.
No one had expected the ban or the restriction on chicken wings coming out of the UK. So we didn't expect a ban on chicken wings, period. And therefore, I think the last shipment of chicken wings could be sometime this week or something like that. But what it means is that the consumption of chicken will remain. And since there is a vacuum or a scarcity of chicken wings, then people will consume more drums and leg quarts and maybe back. So because of the fact that the ban was not expected, what is likely to happen is that you have a shortage throughout the market for chicken, period. And we're trying to see how fast we could scramble some other products out of the US, including wings. But that is proven to be a little bit more challenging than normal.
Despite the current situation, Ford said that chicken will not be rationed and persons can still buy as much chicken as they require. He also noted that after Christmas, the situation of the shortage of the other chicken parts in the country will be resolved.
In December, right after Christmas, the situation will settle down, because while you may not get wings in sufficient quantities, it will increase, the imports will increase in terms of leg quarts and drumsticks and turkey wing. But it will take a couple of weeks to make the adjustment from the brokers to find supply to send to us and that kind of stuff and so on. So there's no limit as far as we are concerned. I mean, you buy until it's done. So persons will buy what they want to buy in whatever quantity they choose to buy and so on. I don't know about any other operation in a business, but we don't have any limit in terms of quantities that people could buy.
Meanwhile, the Ministry of Agriculture has issued an advisory to persons who wish to import or are receiving meat or meat products for the Christmas season that they must first obtain an import permit for the Animal Health and Protection Unit. The ministry said permits will be granted for meat and meat products in their original commercial packaging brought from the USA, New Zealand, Canada, and Australia, and these products must not exceed 25 pounds. It reminds that poultry and poultry products from the UK are prohibited at present. Food products of animal origin are listed to include but are not limited to fresh, frozen, or chilled cuts of meat or poultry, eggs, cooked, smoked, cured, pickled, salt, dried, or canned products such as sausages, hams, hamburgers, and other raw meat patties, hot dogs, haggis, and blood sausages. Also included as food of animal origin are pastries containing meat filling such as patties, meat rolls, rotis, and pizzas. The Ministry of Agriculture has advised further that application permits should be made at the Animal and Health and Production Division at Richmond Hill between 8:30 and 3 p.m. weekdays. In other news, police have arrested and charged 28-year-old Jaron Deroshe, a businessman of French's, with wounding, damage to property, unlawful possession of a firearm and ammunition, and unlawful discharge of a firearm. The police say that on November 13, 2020, at about 11 p.m., the accused allegedly unlawfully and maliciously wounded a 25-year-old laborer of Peterborough by shooting him in his back. He was further charged with shooting and damaging the rear windscreen of motor vehicle PD 232. Deroshe was also charged with unlawfully discharging a loaded firearm within 100 yards of the Kingston Public Road, unlawfully discharging a loaded firearm at the 25-year-old laborer of Peterborough, and with having in his possession 2 rounds of .40 ammunition without a license issued under the Firearms Act. The incidents are said to have occurred at Heritage Square in Kingston. The accused man is expected to appear before the Serious Offences Court to answer to the charges.